reminded me, I guess I haven't quite uploaded the cleaning videos. I don't know, I couldn't find them. So I thought that's an excellent question that someone asked me, I believe, today. My name is Dr. Mkono, and I'm a pulmonologist. And thank you for everyone who is following and supporting my channel. And I hope that you're still involving your doctors, your providers, your nurse practitioners, whoever is participating in your care. It's so important that we remain safe, that I want you guys to elevate your education and definitely run back into those providers' offices or call them and just make sure that they agree with what I'm saying or what you have basically interpreted I'm saying. So I am going to be showing you guys how to wash your nebulizers. I have my nebulizer here. I have connected it. I think the question came on one of my popular videos, which is demonstrating how to use one of these. And yes, of course, it could have been one of these. Either or, if you are using a nebulizer, it is so important that you know we gotta clean it. If you follow me on TikTok, I definitely have a beautiful series about cleaning your devices, and I hope you do. And if you don't, just click on the description of my YouTube channel, and there are other connections there of how you can even see me if you're locally in my local zone or where I practice, which is Florida, by the way. So if you are here, obviously you can see me on UCAN Health. I am a provider on there. You would have to log in as a patient, of course, and then you'll be my patient through there. So either way, I am promoting that we wash our devices, whether you're my patient, my future patient, someone else's patient, it wouldn't matter. I just still promote that you have to know that these need to be washed. Whether you're using one of these, which is a flutter, yeah, I think this has a different name, but hey, cleaning devices for the phlegm. If you have one of those devices that help you nebulize portable, they also need to be cleaned, but I would say make sure that you don't go and dip this into the water because it won't work. And these don't last that long anyways. I always recommend my patients that you're gonna have a nebulizer, right? You should have one that's durable, because these little ones, I love them when you're on the go and for the kids and people who work and they have things to do and places to go. You need one of these, but I'm also gonna be talking to you about how these need to be put in a different place of cleaning, because this is not what I'm saying. Don't dip it into the water. Take the mouthpiece for this one and just throw it into your washing liquid. So what would I wash with? Personally, I advise my patients to take dishwashing liquid. That is the safest, because you use it, you eat and you wash your dishes with it, so it's safe. Yeah, but don't put a lot, and definitely don't use something that has perfume or has an odor, because if you are allergic, obviously you want to use something that's hypoallergic, right? Hypoallergenic, right? Maybe I can never, it's always a tongue twister for me. But I would really recommend that you wash it with dishwashing liquid, any kind, preferably odorless, right? And you would be washing it in warm water, but you can't melt your devices, because as you can tell, most of these devices are made with plastic. So you want to make sure your device is not going to melt in your water. Yes, you're going to want it warm. And why are we washing these things? Because let's say you had an infection, or you didn't even know you had an infection. You definitely don't want to wash something that keep it unwashed and it has phlegm and gunk inside. Then you'll be breathing all that stuff back in, right? So I do want to let you know, at least once a week, or maybe if you can, there's no max, you can do it twice a day, but at least once a week, if you're using these devices, that you're washing them frequently and making sure that they air dry. That's the key, air dry. Dishwashing liquid. If you want to use peroxide, go ahead, use peroxide. I know people are going to ask me. If you want to go and put it in a dishwasher, as a matter of fact, the series that I put on my TikTok has it with the version of me showing you how to put it in a dishwasher as well. That's a valid option. But to be honest with you, if you're coughing and hacking and all that good stuff, if you live alone, fine, put it in a dishwasher. But for me, I think you need to wash it and air dry it because other people are using that dishwasher potentially, right? So hygiene is hygiene. If you've had kids, you would treat it like your bottles for the kids. Wash it the same. So if you're one of those people who have kids and know what to do with your bottles, do that. You can put it on a steamer, all that good stuff. So you don't have to stay. But for everybody else that has never washed this, doesn't have kids, doesn't know what to do with their devices, didn't even know they had to wash them, you should stick around. What if you don't want to wash it? You don't want to wash it, guess what? The other option would be for you to buy this part, over every time you use it every once a week. You can do that too, okay? So that's an option. And where can you get your stuff? Okay, I have a store also on my, little thing about me, what I do, where I am, where you can see me, where I'm located. There's also an Amazon store of me recommending. And within there, I actually did lots of lives, which you can look at, me washing these devices. Definitely stressing the washing because it's important. One tip for those people who are still with me is that when you wash these things, I repeat, do not wash this little piece here. Take it off. We're going to begin now. This little skinny tube, this right here, right? Don't wash this. You don't need to wash this. This is blowing, when you put it in your machine, it's blowing air one way. There's no reason for you to have air coming back through it. It is going to pump your nebulizer into this. And you just need to disconnect it, especially since if you do and you put water inside of here, this is a tip. You put water inside here, you decide to force water in here, this will not work. And when you connect it, I've seen a few people come to me in my office, my machine is not working. And it simply is there's water stuck inside here and it won't work. Your whole thing won't work. So take this, put it to the side. Be like, you don't need it right now. Once you've washed everything, then you can reconnect everything with your dry skinny tube, okay? So again, I'm sorry, I dropped something. I need you to know that this is going to be washed, okay? The liquid is in there, and this is gonna be washed, but this skinny tube will not. So I'm just gonna connect it and show you. Of course, when you do this, you're going to be connecting the skinny tube, right? I have showed you guys, and I have a video that's very popular. It's probably the most popular one on YouTube. Not the most popular one on TikTok, but the most popular one on YouTube is apparently this nebulizer. So most of you have probably seen me connecting a nebulizer. I have a separate video. You connect this little tube here. This tube needs to be disconnected, okay? And then, you wash it. Okay, so you would disconnect this, put it on the side, and then I'm going to lower this so that you guys can see. I am going to show you right here at the sink what I'm doing. For those people who do know what they're doing, that's fine, but there was a particular lady that asked me how to wash. I would get a clean, of course, basin. And make your water lukewarm water or warm enough that you can wash everything, right? And you would put everything inside, and you would put it inside with your dishwashing liquid, right? And I know you probably won't hear me, but I would soak it. I would put some soap in there and dishwashing liquid, any kind that you would wash your dishes with. And you would put very little of it, not too much, right? And then you wash it. If you want to wear gloves, do that. But this is your device. Once you wash it, it should be hot, right? You can throw in here your spacer. If you have a spacer, yes, that needs to be washed too. You would disconnect it all together, and you would put it inside the warm water, right? And wash it. Now the key here is making sure that you get a brush. I actually do not have a brush with me. I'm gonna go and grab one. But get a brush that you would use to clean this. So I'm gonna, excuse me for a moment, I'm gonna go get a brush. All right, so you're gonna get a brush. You're gonna get something that's long, you know, just the usual thing, anything. You would wash with, this water should be warm, right? It should be warm, really. It should be warm because we're trying to get rid of all those little bacteria that have been sitting on here and use this as their landing pad and their replication pad. So you're gonna clean it out, wash it really, really good, right? You're gonna put all your little, clean it out and clean it all the way. And once you're done, it's very simple. You're going to rinse it off with warm water again, right? You're gonna rinse it off. And I would rinse it off a few times. I really would. And I will not plan on using anything like a towel or a paper towel. I would just air dry it, like I'm gonna show you in a moment. Because air dry is much cleaner and there's no particles. And again, no perfumes, no scented soap. And you can use peroxide. My take would be do wash first and then maybe soak it in peroxide if you decide. Peroxide is definitely an option. Some people might even say vinegar. For me, I really think the washed water is just fine. Just use warm water. Clean it out really, really good. And then once you've rinsed it off a few times, getting rid of all the soap residue, realize that if you have asthma, you're sensitive. You're not gonna wanna put any fumes onto your devices, okay? So again, my name is Dr. Mkono, and I'm just trying to answer someone who asked me a question today and said, how do you clean that device? And that was a nebulizer. And I basically said, well, I think I have that video already on my panel. And I realized, no, it's not. It's on TikTok. I have a series that I did on cleaning devices on TikTok. But if you follow me on Amazon as well, I definitely have had a few lives, if it's still available, a few lives showing you how to clean these devices. And I went through all the range of devices, including how to clean these devices, okay? Realize your phlegm is also going to invite bacteria, even when it's inside of you, because it shouldn't be inside of you. You need to get rid of it. And it should definitely not be on your devices, but it will be because you're breathing in and out. All the air is going to settle down on your devices and become a landing pad for bacteria. So we want to clean it once or twice a week, okay? If you can do more, great. And this is what I would do. I would air dry it, okay? So I don't know if you can all see it, but this is what I did here, you know? You would air dry it. And for some of you guys who are comfortable, you know, you would want to put it in a dishwasher after this. That's fine. But take your little parts, air dry it, and you're going to assemble it later. Keep it one piece at it, but each piece by itself. So I have a nebulizer head with the nebulizer mouthpiece, but you can also have a mask that looks like this. You know, that will be washed too. You would wash it, and then you would lay it there to air dry. A few hours later, it will be dry. The one thing I want to remind you guys again, because it has a big problem if you don't listen, is you're going to go buy a new machine, but you didn't know that you washed this piece. Do not wash this skinny tube. Do not wash it. I say, do not wash it over and over again, because people have literally either bought a new device or think it's not working because it gets water. And even if you connect it, right, it won't work. And I think drying it through here is hard too when the water goes in here. So you don't need to do anything to this. And why? Because it's going to be blowing air into your device, and you do not need to wash it, okay? That is my recommendation to you, that you don't need to wash it. You can just maybe wipe it with alcohol if you desire, but you definitely don't need to wash it. And again, my name is Dr. Mkono. I was so happy that this person asked me this question. It was an excellent question because it really got me jumping off my couch and just coming straight to making this video, because it is such an important topic to cover within YouTube. But if you follow me on TikTok, I definitely have a series there. And if you follow me on Amazon, yes, I have an Amazon like recommendation store. You can definitely go on there and you definitely are going to see me spending lots of time washing, cleaning, talking to you guys, motivating you guys to do the right thing. If you have an infection, if you already have Pseudomonas growing, God forbid, or any of these bacteria, then you know what? One of the things you should be doing is making sure you clean out your lungs and then clean out your devices. And you should definitely look up the things I recommend on there about cleaning your lungs. Things like flutter valves, acapella, VibraPrep. There's a lot of devices that help you clean out the phlegm, but we're working together on here on how to prevent you from even creating that phlegm, and that will be good control of your disease. If you have good control of your asthma, you will behave like a normal person. Now, it depends on your severity. If you have severe asthma, maybe you would reasonably be controlled to the point where you don't have to be in a flare constantly. But if you're seeking medications every 5 minutes, you're waking up at night and you need your inhaler constantly, guess what? I don't care if you think you have mild disease, you have severe disease. And maybe you have something else going on and somebody needs to do a chest x-ray or evaluate you, or you're not using your inhaler as you should. By the way, it is the inhaler technique that matters the most, but it should be followed nicely with you being on a schedule if it's a fixed maintenance device. If you don't have a fixed maintenance device, ask your doctor why, because if you have bad asthma, you should have a fixed device. What does it look like? It can look like any. It can look like the ones that I teach every day. And therefore, you need to go back and say, well, you know what? They told me every day and I use it every month. That's not going to help. And that's going to cause infections. Nebulizers should really be happening every once in a while. If it's a constant thing, you're always on a nebulizer, maybe there's a problem. Maybe you don't know how to use your inhaler. That's the reason you're on a nebulizer. It could be as simple as that. Or maybe you're coming down with a cold or an infection. Somebody needs to attend to that before things get carried away and land you into the ER. So learning that suppression of your asthma is key. That's why I'm here. My name is Dr. Mkono, and I hope you guys enjoyed me talking to you about a topic. So I'm watching your videos. I'm watching your questions during my videos. And when you do write me a question, I am responding. I mean, either encouraging you or telling you something you may have missed, which is look up all my videos. There is content below the videos that summarizes the key points. Make sure that you're learning these things, because if you know your disease well, you will do very, very well. And at least you'll be ahead of the disease, which is always good. Take care, guys. See you next time.